has been drawn to my attention that there have been a whole set of accusations that are being heard at the ministry and at the minister himself in relation to this last cluster, and I just wanted to set the record straight. I am a bit surprised, to be honest with you, at the things that I'm hearing, because I am convinced that people already have not been following the press conferences over the last year and a half or so. The first thing I wanted to point out is that we do not mention the names of institutions and organizations unless they're government. For example, when we had outbreaks at the psychiatric hospital or geriatric hospital, yes. And schools, yes, we mentioned those names, but we didn't mention the names of private schools, for example. I was being pressured by the press to name the church in the north, which I was referring to on several occasions, and I am absolutely sure that up to this point I have not indicated what the name of that church is. And so this has been the practice from inception. This has been the practice of not mentioning, because that is the way. And I have explained this on more than one occasion. This latest cluster, which we've been observing now over the past couple of days, it is a St. Michael business, and that is what I've said. There have been names of businesses and institutions mentioned in the press, not by the ministry or not as a result of a press conference, and not by the Minister of Health and Wellness. Some business places have made that decision on their own, and they have indicated such in the past. And the press has also been mentioning names because they would have done their work and they would have obtained the names of places, but it has not been the custom of the Ministry of Health and Wellness and the government of Barbados throughout COVID-19 briefings to do so. So this is absolutely no different scenario. This is how we've been dealing with it all the time. We've never mentioned the names, for example, of the nurseries that have been impacted or the elderly care facilities. I would always say in the north, the south, or whatever, but I'm sure that we have never gone the route that people are suggesting that we have gone before. And there's absolutely no need to hide. We've been as transparent as possible. There's no way that one would be hiding information in relation to a cluster that I had indicated was about 7 at the time. When I reported, then we had 200 cases and 180 and 75. And then things were in a much more precarious position. At the moment, the country continues to do well in relation to the positivity rate and all of the other indicators, and I would have said this repeatedly. I would have explained where we are. This is not a big worry for us, although it is a concern, as I indicated to the press yesterday at an event. It is a concern because if we are having single-digit cases, and we've been doing quite well for a long time, as you know, and then we see 7 cases coming up in one business or one institution, then that is a concern. And that suggests exactly what I have indicated yesterday. And we are pursuing that matter. Contact tracing, aggressive contact tracing has started. The entire staff of that company are to be tested. Most of them have been tested already. There are over 40 people in quarantine. And we are working on that matter. There are 2 polyclinics and 2 catchment areas that have been tasked to lead the investigations, and we have every confidence that they will do what is required to be able to help us to contain this particular situation.